The following program has been furnished and paid for by Ask the Expert Show. KSEV is not responsible for its content or the products or services offered. Welcome to the Ask the Expert Show with local experts in the field of health, legal, financial, and home improvement. Now, here's your host.
And good afternoon. We welcome you to another edition of Ask the Expert right here on AM 700 KSEV, the voice of Texas. And as you heard in our intro, we do talk about different fields that might be very helpful for you. And today we're going to be talking about home health and hospice care. Some of our KSEV listeners may be needing it, or maybe you might have a loved one or a friend who might need some quality home health and hospice care. We got just a man here to talk to you about that, Felix Cannibal with Avatar Home Health and Hospice Care. Felix, thank you for joining us for another edition of Ask the Experts here on KSEV.
Thank you. Thank you for allowing me to talk to our listeners out there and give them all the information that we can give them in the short time that we have. But we've been doing this every Sunday now for about almost going on 18 months, I think. So please, tune in and listen to us every Sunday at noon. We'll give you as much information as we can.
And just to prove, folks, that we're not just didn't grab Felix off the street to come in and talk about it. He's been around, as he said, for quite a while. In fact, a lot of good awards you've won here, Felix. I'm looking at the sheet here. It's JCAHO accredited, Medicare certified, Medicaid certified. Go over a little bit. I know we mentioned it before, but in case of we've got some new listeners out there, JCAHO accredited. Explain what that is a little bit.
Right. Well, that's basically, in order to, let's go a little bit before that.
Okay.
Okay, so when you open an agency or you try to start an agency, a home health agency or a hospice agency in the state of Texas, obviously you have to apply for a license, a state license. You have to prove that you have liability and no malpractice insurance. And of course, you have to be a qualified individual when you apply the certain requirements that there's too many to talk about them now. But basically, so they look at your personal, your criminal background, all that good stuff. And then you get a license. After you get a license, you have to start treating patients without getting paid because you're not Medicare certified yet. Mm-hmm. So the state allows you to take care of some patients, even though you're not Medicare certified, but you still are expected to follow Medicare guidelines. So and then you apply for Medicare and say, okay, I'm treating patients, come and inspect me. So Medicare comes and they inspect you. They could take 2 or 3 months or a year. It's up to Medicare. After they inspect you, they're going to certify you. That means that now you can bill Medicare for your services. Now, Medicare, as any government, most government agencies are overworked and overloaded there's so many applicants and so many things going on in healthcare that they don't have enough people to take care of all these new agencies or all the requirements that they have to implement. So what they do is they have picked an agency or an entity called the Joint Commission, which is also this JAHO.
Right. Uh-huh.
Right. But in short, they call it JACO. In the industry, they're known as JACO. And these people have the task, this entity has the task of inspecting hospitals, clinics, home health agencies, hospice agencies, and then come out and they see if you're meeting the Medicare requirements. But then if you sign up with the Joint Commission, then they expect you to meet their requirements that are much higher than Medicare requirements. So that is why only 9% of the agencies in Texas have received the gold seal of approval from this organization.
Which is what you guys have.
That's what we have. So when people say, well, all the agencies are the same, well, no. All the agencies follow the same requirements, the Medicare requirements. All the agencies are supposed to take care of the patients and do the best they can to take good care of the patients. All the agencies are supposed to follow the HIPAA regulations. In other words, the new kind of privacy act that has been implemented to keep people's information safe. We're supposed to do all that, but there's some agencies that are better than others. And I'm proud to say that we're one of the best agencies in the Houston. Well, actually, we cover all of Harris and Montgomery County. So very few agencies can claim what we can claim. And one of the claims that we make is that only 9% of the agencies in the whole state of Texas have received the gold seal of approval from the Joint Commission. So that we're very proud of.
9%, that's pretty good when you consider how big a state Texas is and how many agencies we have here in the state of Texas. That's pretty something you could really like to hang your hat on there.
For sure, and there's more agencies in Texas, and I'm going to make sure that I can back this up, and I'll do the research for next Sunday. But I believe that there's more agencies in Texas than all the other 50 states combined. Or very close to it. Or we have a high percentage of agencies.
And that might stand to reason considering how big a state Texas is.
Well, that and all the states, they have moratoriums. In other words, like in Florida now, there's certain areas in Florida that you cannot open a home health agency if you wanted to. I believe the Carolinas are like that. And, there's certain states that have put a limit. So if they have 100 agencies, that's it. They're not going to have any more. If one of those agencies shut down, that's it. They now they only have 99. So, but Texas have a lot of agencies. There's a lot of competition, which is good for the tenant, for the patients. But then again, it might lead to be exposed to some agencies that do not offer the quality of service that the patients deserve. But if you want to make sure that you get good service, just call Felix. Just call me at 281-703-8050. That is 281-703-8050. And I can give you information about not only about home health, but about hospice, caretakers, provider services, Medicare benefits, Medicaid benefits, assisted living facilities, nursing homes, group homes. Any question that a person, a senior citizen, or a person that has some kind of illness, chronic disease, if you know of somebody that's, for instance, if you know somebody like, say, an old couple or an older person that's living by themselves, and even if you only think they need help, give me a call at 281-703-8050, and we can discuss that. And I'll get in my car and I'll go meet that person and see how we can help them. And if we cannot help them, then what we do is we get that person in touch with an agency or someone else that can help them.
And I know we talked about it before, but like I said previously, for some of our new listeners, let's get a little bit bases on the details as far as what your services provide. You do come home. I mean, not you come home, but they go to the person's home, their clients, and they do a multitude of services. Can you kind of get into that and talk about some of the services that Avatar does provide for their clients?
Sure, and that's another thing that makes us a little bit better, or much better than most agencies. At Avatar Home Health, we provide you with home health service, we provide you with hospice services, and we provide you with caretakers or provider services. So in other words, we are like having 3 agencies in one. Our license encompasses most of the services that you can receive at home. So let's say that you need a nurse to go and visit you and take care of, like, say, wound care, or teach you how to use the medications, or make sure that you're taking the medications correctly. So we can provide you with that. Let's say you're a diabetic and you need a diabetes management, somebody to make sure that you're taking the insulin, how your insulin level is. Any kind of help that you need at home from a nurse, we can provide you with those services. Now, also in home health or hospice, we can provide you with a physical therapist, occupational therapist, a speech therapist. So all those services are included in either home health or hospice services. Also a home health aide. So if you're limited as to what you can do for yourself, let's say that it's not safe for you to take a bath on your own. Now, a lot of people take the risk and say, yeah, I can do it. And then, unfortunately, Jack, the way they find out is when they fall down. Now they have fallen. Usually, and this is just the experience of having done this for 14 years, going on 15 years now, Jack. Unfortunately, most old people that fall down, like say in the bathroom, you know what they're going to break, right?
That's a dangerous place to fall down to, in the bathroom.
Exactly. Actually, that's the most dangerous place in the house. But normally they break their hips, one of their hips. So what happens? And this is, I'm sorry if you've broken a hip, lately, some time ago. I don't mean to scare you or anything like that, but you got to be careful, because usually once a person breaks their hips and they have to go into this, long therapy session, and this, it's a long recovery period, they don't do well after it. 2-3 years later, probably they'll pass. And that's something that's very scary. So do not take a chance. If you feel that like say when you're walking around your house, if you're holding on to the furniture, please call me at 281-703-8050. Don't be taking chances, because the consequences are very grave. So something like that, we can help you with a therapist. I was going like, so you need help taking a bath or doing things for yourself, like preparing a meal, cleaning around a little bit. You call us, we'll provide you not only with a nurse, but with a home health aide that can go to your home 2-3 times a week, help you with a bath, help you with the things that you need help with. So then we also can provide you with provider services that you need to qualify either through Medicaid or through a long-term insurance policy. So those are people that also go to your home and spend 2-3 hours a day at your home helping you with your daily activities. So please, whatever you do, even if you don't think you need help now, give me a call at 281-703-8050. Talk to me. Let me send you some information. Keep it handy. And whenever you or someone you love or someone you care for needs information or needs help, you have the information there with you, and then you can call me.
All right, we're going to step away, and we're going to talk more with Felix about the services that he provides, and we're going to go into a few more questions that we have here we'd like to pose to Felix regarding some other things regarding Avatar Home Health and Hospice Care. I'm Jack Gonzalez, and you are listening to Ask the Experts here on AM 700 KSEV, the voice of Texas.
Do you or anyone you know need help with your daily activities, grocery shopping, bathing, cleaning, cooking? If you do, Avatar Home Health and Hospice can help you. Avatar Home Health can also help if you need nursing services and or therapy services in the convenience of your home. If you live in Harris or Montgomery County, in most cases, they can start services within 24 hours of your calling them. Avatar Home Health and Hospice was established in 2006. Avatar Home Health and Hospice is not only Medicare and Medicaid certified and licensed and insured, but is one of the few agencies that has received the Gold Seal from the Joint Commission. This accreditation has only been granted to less than 9% of the agencies in Texas. At this time, Avatar Home Health and Hospice takes care of over 340 patients. Whether it's home health, hospice, or caretaker services, one of their 220 professionals will be assigned to help you. Avatar Home Health accepts Medicare, Medicaid, United Healthcare, Aetna, Molina, Humana PPO, and other insurance companies. They also accept private pay patients. They can also help you find what benefits you qualify for. Most of their services are paid by Medicare, Medicaid, or your insurance company most of the time, without any out-of-pocket expense to you. Call Avatar Home Health and Hospice at 281-703-8050. That's 281-703-8050. Or email them at info@avatarhomehealth.com.
And we welcome you back to Ask the Experts here on AM 700 KSEV, the voice of Texas. I'm Jack Gonzalez, and we are talking about home health and hospice care. And the man giving you all the information regarding that, Felix Scanabar with Avatar Home Health. And as we continue, Felix, we want to talk a little bit about some of the services that you do provide and some of the people who now you've taken on board who will now help people pay for some of these services. Now, we mentioned Medicaid before, Medicare, but you've mentioned earlier you have some new people who are willing to help you as far as help our listeners, that is, regarding the cost.
Sure. Basically, All our programs are either paid by Medicare, Medicaid, or an insurance company. Obviously, you can pay out of pocket too, but that it becomes very expensive, like anything in healthcare. So patients, normally our patients are either have a Medicare plan or a Medicaid plan, or maybe a group insurance or a private insurance. So we accept besides Medicare and Medicaid, we also accept United Healthcare, Aetna, Molina Insurance. We do have a contract with the VA, so we're proud to serve those who have served the country. We have approximately 40, 50 veterans that we take care of, and those are paid through TriWest, which is the insurance, one of the insurance companies that takes care of the veterans. We also have a contract where the Department of Treasury, in other words, the Veterans Administration, pay us directly for the services we provide. We accept most PPOs, so no matter what insurance company you have, if you have a PPO, most likely we'll be able to help you. We accept the new companies that came on board lately, because now there are more companies offering these Medicare replacement policies. So right now, you just signed up with U.S. Family Health Plan, Christus, a Community Health Choice, Marketplace, Community Health Choice, Star. So the best thing to do, because there's so many insurance companies out there, Jack, the best thing to do is just give me a call at 281-703-8050. Tell me, I will ask you 2 or 3 questions, and I'll be able to look what services you're eligible for free of charge. It's not that I'm not going to charge you for, obviously, I'm not going to charge you to look up the information for you, but I can give you a list of all the services that you could have free of charge right now. And that the way that we do that is we ask you for some basic information, which is basically 3 or 4 questions. We ask you the name, your date of birth, your Medicare number, your insurance, and so on. And we go into the Medicare database, or we talk with the insurance company, and we ask them the services that you're entitled to. And we call you back and say, okay, all these services you can have with zero copay, zero deductible, and no out-of-pocket expenses.
That's great.
That's in most cases when we're talking to somebody who's a Medicare patient or they have a Medicare replacement plan. If you have a group insurance, in some cases you have a copayment or deductible, you have a med, but those are rare the cases, because usually we get somebody that just came out of the hospital. So once you go into the hospital, you're going to meet the deductible. So by the time you get to us, you have met the deductible. But don't worry about how much you have to pay. Call me, and I'll find out for you, and I'll tell you exactly. And 99% of the time is you're not going to pay anything to us. Everything is either paid by Medicare, Medicaid, or your insurance company.
And that's a great service you guys provide, because some people may not know the questions to ask or where to look or how to find out certain things. So you guys just take it upon yourself to say, okay, well, we'll help you along that path. Just give us the information and we'll do a little research and we'll take care of that for you, because you never know, someone might misunderstand something, think they don't have to pay for something and wind up paying for it. And so that's a load off a lot of people's mind, is, for looking for, because free is good, especially when you find out involving home health and hospice care.
Of course. And one of the biggest problems we have is people call their insurance company and they tell them, okay, so they ask the insurance company, okay, so am I entitled to this, especially when it comes to home health? And the insurance company might tell them, yeah, you're entitled to 38 hours a week. I don't know what that means, Jack. There's no such thing as 38 hours a week. So then they call us and they say, okay, we want services, and they give me the information, or they send us a doctor's order. And then we go out there and we tell them the services they're going to get and say, wait a minute, I'm supposed to get 38 hours of service. So what they think that means is that they're going to have somebody at their home helping them 38 hours a week. Mm-hmm. That is very misleading. I don't know where some insurance companies get these answers from, but that's not going to happen.
And you've had patients who have actually said you that they've been misunderstood, or they misunderstood, or told the wrong information. Many.
They call Medicare and they say, well, how many hours of help can I get at home? And they say the standard answer is 8 hours a day. That is not true.
Ooh.
That is not true. We send the nurse out there. The nurse is going to stay with you an hour or so, depending on your needs. The home health aide might spend an hour or so, depending on your needs, and the same with the therapist. But there's no 8 hours a day,
Right.
They're very special cases, but most of those go through Medicaid.
Ah.
Okay? So you have children with disabilities and stuff like that they handle by Medicaid, and they do get extra help. But the average person, the average patient, it doesn't qualify for those benefits. So please, before you count on something that somebody that you just picked up the phone and called an insurance company, before you get confused with them, or actually after you get confused by them, after you get the information from them, call me at 2817-038050 and tell me, hey, Felix, this is what the insurance company said. And in 9 out of 10 cases, they gave you the wrong information.
And that's something that's, like we said earlier, is just terrifying. You're expecting one thing and it turns out the other, and then they say,
yeah,
they fork over the
exactly.
cash, and you say, wait a minute, I thought it was covered. And they said, oh, no, not exactly.
Or they say, well, when the salesman was here, when the agent was here, well, the agent, and I know there's a lot of good agents out there, but
Sure.
the agents are motivated by a commission they're going to make. So they tend to bend the truth a little bit, or to exaggerate, or maybe to leave something out. So you find out, like I tell people, you're going to find out when it's too late. Because when you need the help, when you need the care, and you find out that you sign up with the wrong insurance company or you have the wrong coverage, then it's too late, because then you cannot change.
And that's why it's a good time to do this early, before you actually need the service.
Exactly.
Because if you need to do something, or if you need a little bit more time to make that decision, or for research, you find out way in advance, and then not at the last minute when you really need it. And I wanted to jump into one other thing regarding medical equipment, Felix.
Yes.
Can you help patients with that? We talked about your services. Now, what about the medical equipment? Can you help them get information on that?
Sure. We can help them not only get information for that, but we can also help them get the medical equipment. Now, we're not a medical equipment company.
Right.
So we don't make any money
You
or
don't
anything.
have the equipment yourself or
No,
anything. Right.
no, of course not. But we can help you, because the biggest obstacle on getting medical equipment through Medicare or Medicaid, or an insurance company for that matter, is to have the right documentation. So it used to be that a doctor could write on a prescription pad and say, a patient so-and-so, date of birth, needs a wheelchair. And that would be enough. Or they need a hospital bed. Long time ago, that was enough. Nowadays, the doctor has to specify the diagnosis. Why is that patient not able to walk? So they have to give the diagnosis. They have to tell us, like in the case of a bed, they have to tell us that patient needs to sleep at a 65-degree angle, and everything, if it says 60 instead of 65, that patient's not going to get the bed.
Wow, I never knew about that.
Yeah, exactly. So people say, well, I asked for my bed 2 weeks ago, and I don't have my bed yet. So when we look into it, the doctor did not write the order correctly.
Oh.
You see? So, and the doctors are not at fault, because Medicare is changing all the time. So don't get mad at your doctor. Don't get mad at your home health agency. Just work with them, trying to help them. Like I was talking to a patient earlier today, before getting here. I talked to the daughter of one of our patients, and I had to explain to her that if a nurse wants to go see the patient on a Sunday, it's because we got a phone call from a doctor telling us, go see this patient. So we're just trying to help that patient. So unfortunately, in this case was a daughter of the patient. She was upset because why are we going to send a nurse on a Sunday? Now, think about this, Jack. A nurse that is working for us, she'd rather stay home and not go to a patient's home on Sunday. Even though she's going to make some extra money, these nurses make plenty of money. They don't need to be working on Sundays. They do it because they're committed to help the patients. A doctor called us early and say, I want a nurse to go check this lady's, I don't know what it was, the blood level, the glucose level, I don't know what it was, but they gave us an order to go see this patient. So we have to go out there and see this patient, because we have to do what's best for the patient.
And that's great commitment by your part because, like you said, not a lot of people want to work on Sundays. But your nurses, and we've read a lot of testimonials about them as far as how good they are. And a lot of your patients really do appreciate and they create this bond with them. And they say, well, gosh, I'm not going to get to see you're my nurse anymore because of, I'm not required to have this service anymore. And they want some way to keep it. And speaking of the nurses, Felix, before we do sign off, because we only have a couple of minutes to go, as we mentioned, your nurses do a great job.
They do.
There might be some nurses out there that might be looking for work and like the way you sound as far as the way you run your company. So I think you said you wanted to make an announcement and let people know that if they'd like to work for Avatar, they can do that.
Yes. We're actually, right now, we hiring nurses. This last week, we hired 5 new nurses, and we have room for another 10. The growth of our agency is going through the roof. People are learning about Avatar Home Health. I mean, we've been around for a while, but now it seems that it's just taken off. We have increased our census about close to 40% in the last 6 months.
Wow.
So please, if you're a registered nurse, an LVN, a home health aide, please call me at 281-703-8050. I'll explain to you how we work, how much money you will be making. Some of our nurses are making over $100,000 a year.
Wow.
And they work a lot. But
Sure.
if you work hard and you help our patients, you're going to make a lot of money. So I'm not promising every nurse out there $100,000 a year, but I'm telling you, if you're willing to work hard, Avatar Home Health and Hospice is the place to work for. So please call me at 281-703-8050.
Is that something get information on the website as well, too, Felix?
Yes.
Okay.
Yes.
Okay, so
do.
avatarhomehealth.com is that website. So if you're looking for work, or once again, going back, if you're interested in the services, either way, either call Felix or go to that website and find out the information you need. And we guarantee you, as we said, he wouldn't be in service for 14 years if he wasn't a good company to work for or a good company to have working for you. Felix, thank you once again for joining us for another edition of Ask the Experts here on KSEV.
Thank you, Jack. Thank you for having me.
You're welcome. I'm Jack Gonzalez, and we thank you for tuning in for another edition of Ask the Experts right here on AM 700 KSEV, the voice of Texas.
Thanks again for tuning in for another Ask the Expert show right here on AM 700 KSEV.